So now we're going to look at the morphologically left atrium. And to show you the morphologically left atrium, I've had to turn the heart round so that we're looking at its left lateral side. So let me orientate you as to directions. Here is the cardiac apex, and this is the sternocostal surface of the heart. The heart is lying on its diaphragmatic surface, and so we're looking at the left lateral side of the atrium, and here we see the aorta emerging from the left ventricle, the pulmonary trunk emerging from the right ventricle. So our view of the left lateral aspect of the heart shows us that the left atrium is the most posterior of the cardiac chambers, because the esophagus would be running directly behind the heart in the position shown by my probe. So if we look at the components of the left atrium, we first of all see its obvious appendage. And you see how different the appendage is relative to the right appendage. Now, unlike the right appendage, the left appendage truly is a part sticking out of the atrial chamber. You see it has crenellations along its inferior edge. When I open the atrial chamber, you will then see that the appendage has a very narrow mouth. There is the mouth of the appendage, and the pectinate muscles on the left side are confined within the tubular appendage. The larger part of the left atrium is dominated by the venous component, and the venous component forms the roof of the chamber. And entering the roof at each of its corners, we have a pulmonary vein. So we have the left superior, the left inferior, the right superior, and the right inferior pulmonary veins. And then between the openings of the pulmonary veins at the corners of the chamber, we have the dome of the left atrium. If I take you forward, I can then show you the anterior interatrial groove. And as you see, lying within the anterior interatrial groove, we have the aorta. There you see the right coronary artery, the left coronary artery not visible. But this shows us how the anterior wall of the atrial chambers is directly adjacent to the aortic root, an important point for the interventional cardiologist. Now, as I open the left atrial chamber, in addition to the dome of the chamber, which receives the four pulmonary veins, we can see that the left atrium also has an extensive body. And the body supports the pulmonary venous component, smooth-walled in its roof. On its anterior aspect, we have the septal component. And remember, this is the heart that has probe patency of the oval foramen. So again, if I put my probe through the inferior caval vein, I can lift away the flap valve of the oval foramen, and this is the true septal component. The wall above the flap valve is the infolding of the anterior and the superior interatrial groove. We can also see that, like the right atrium, the left atrium also has a smooth vestibule, but the difference between the right atrium and the left atrium is that in the left atrium, the smooth wall of the vestibule is confluent with the smooth wall of the body, and in turn, the smooth wall of the pulmonary venous component. So the larger part of the left atrium is smooth-walled, and when we see this smooth-walled inferior atrioventricular area, we know we are dealing with the morphologically left atrium. Running within that inferior atrioventricular groove, of course, we have the coronary sinus, and we'll look eventually at the coronary sinus, which is the conduit for the return of the coronary venous blood to the right atrium.